Our fourth presenter is Gerard Hutchinson. Gerard, I do not have a biography for you. So you will perhaps do a one-sentence introduction as you go forward. But Gerard is particularly clearly interested in mental health, and he's going to look at the socio-economic impact of mentally, and I'm going to change the title here, mentally healthy society, because I have a mentally stable society. And I'm doing this in honor of my mother, the first psychiatric social worker in Trinidad. She would react because she would ask you, what is a mentally unstable society? So, Gerard, I'm looking forward to your perspectives as your seriously, your title is Mentally Stable Society. Thank you.
Thank you. Thank you, Madam Chair. And of course, it's an honor to be here, honoring Professor Theodore for his seminal work, and of course, the Health Economics Unit. So my talk is entitled The Socioeconomic Impact of Mental Health, and the journey that took me down this road was started by a quote I read by Bill Clinton, a Time magazine interview in 2012, when he identified one of the priorities of his global initiative to be the health of communities, because he said that healthy communities prosper. And that, of course, took me back to the World Health Organization's mantra-like definition of health, which says that health is not just the absence of disease, but the presence of ongoing well-being, as well as, perhaps more importantly, the capacity to optimize one's potential. And developmental economist named Amartya Sen, I always recall his quote that poverty is about capability deprivation. And if one is to optimize one's potential, then it means that one is going to optimize one's capability. And if one can't do that, it means that you're likely to dwell in some kind of poverty. So I think this prosperity that Bill Clinton talks about is both material and psychological, and important in the whole process of understanding the relationship between health and economics. So that then took me back to a paper that was published 8 years ago by a team of psychiatrists and health economists in Britain, and they argued that there was no health without mental health. Of course, without the introduction, you'd see that the fact that I'm talking about mental health, it means that my work is connected to that, and I am a psychiatrist by training. But the issue of mental health, I think, tends to be looked at in a compartmentalized way. But what Martin Prince and his colleagues were saying is that mental health and physical health engage in an ongoing conversation, and mental health, or good mental health, leads to good physical health, and good physical health leads to good mental health. And many health conditions predispose you to having mental health conditions, and of course, mental health conditions as well predispose you to have physical conditions, as we'll see as we go along. So, as part of that work, they averred that depression is perhaps the strongest single predictor of physical and social disability. And that's quite a powerful statement, because it means that many of the behaviors, one, that lead people to developing the chronic non-communicable diseases come from a place where they may have been depressed. Many of the behaviors we've talked about this afternoon regarding risky sexual behavior as well come from that place. And that relationship, or those relationships, are illustrated in the finding that mental disorder is independently associated with all-cause mortality risk. And in places which have unevolved mental health services, people generally die younger, not just those who have mental health problems. And as an illustration of that, a team from King's College London, the Mental Health Economics Unit there, they looked at a diagnosis of conduct disorder. Now, in psychiatric terms, conduct disorder is a diagnosis given to children who fight a lot, who miss school, who run away, who lie, who steal, and who do that in a repetitive manner in spite of being punished. So they end up being expelled from school and end up in homes and stuff like that. And what they found was that the cost for one child who has a diagnosis of conduct disorder over time is as much as between 120 and 140,000 euros. Most of that cost coming through crime, as you see there. And of course, other things, lost employment, problems with relationships, and of course, their compromised education. And of course, if your education is compromised, it comes back to that point about capability deprivation. And if you look at a model of mental health, you'll see that the factors that contribute to good mental health are related to things like family environment and social circumstances, education again, employment, working conditions, housing, and the outcomes that arise out of good mental health are, as we said, going back to the World Health Organization definition, high levels of well-being, physical health, knowledge and skills, good quality relationships, sexual satisfaction, the ability to use services, productivity, and public safety, all of which relate to the problems that we face in the society. And speaking of the society, there's an organization, they're based in London and Sweden. They carry out something called the World Values Survey. And I don't know why they chose Trinidad as one of the countries they survey. They survey countries around the world. Trinidad is the only country they survey in this region. But what they have found, and the data is available online, and it's administered here by HHB Associates and the Mori poll people, is that levels of trust in Trinidad are extremely low, as evidenced by those figures, comparing to the group mean across the world. Of course, confidence in the police system is low, the justice system. Interestingly, that people would take advantage of you is much higher than the group mean. So it means that we live in a society, whether it's because of the historical trajectory we've been on, or for other reasons, the divisiveness that sometimes occurs, where trust is low. But that in itself becomes a problem, because in low trust societies, you get things like a lot of corruption, and more importantly, institutions that don't function very well. This work was popularized by Francis Fukuyama in the 90s. And of course, in a place where institutions don't function well, you get these kinds of socially disruptive problems: criminality, family disorganization, the lack of faith that institutions would work for you, things like juvenile delinquency. And again, those things you can see reflected around us. And I think that those things tell us that there is a problem with mental health in the country, and perhaps has been so for a long time. From a technical point of view, neuroscientists talk about the capacity to navigate through social landscapes as a means for developing good physical and mental health. And they see that base as being the capacity to form durable social bonds. And of course, if we're not doing that, it means that immediately our physical and mental health is compromised. And again, if you look at our stats for non-communicable diseases and for some mental health problems, and of course our crime problem, substance use problems, you can see why that might be so. And as evidence of that, I took this quote from the newspaper about the man who was decapitated in Port of Spain, found decapitated.
Gerard, can I just stop you for 1 second, because you really have some excellent slides, but we are not able to see it. Is anybody able to help us really quickly? Okay, thanks. Just push the code in a little more. There you go. Simple technology. Thanks.
Right, so this is about this guy who was decapitated. And again, when we see and hear news like that, we tend not to see the ecology that surrounds these kinds of experiences. So here's a guy who was a son, a brother to 8, siblings, a father of 3, grandfather to 7, uncle to 22 nieces and nephews. And all of these people would have been exposed to that, the trauma of his death, and of course perhaps the things that led to his death. And in being so exposed would therefore inevitably have some mental health consequences. And of course, as a society, because of the high rates of crime and violence, we all now are being exposed to that in direct and indirect ways. Most people now, certainly most adults, would know people who've been murdered or who've been subject to some kind of assault or violence. And the effects of that, as demonstrated by this quote, speak to how values and behavior might be compromised because of that exposure. Loss of trust in the community, sense of self-hatred, inability to care, a breaking down of the sense of security and reality. And of course, all of those things contribute to that sense of well-being that we talked about with health. And research here regarding gang membership and gang involvement has shown that these are the factors that tend to be associated with it. Of course, availability of guns, residential mobility, which again is something that we don't take as seriously as we should. People moving from community to community and how it impacts on their lives, and why you see changes in terms of the distribution of a range of behaviors. Having parents who favor antisocial behavior, antisocial peers, and of course having peers who use drugs. And again, those things all kind of hover around the mental health axis. And on the flip side of that, those with social skills, belief in moral order, and engaging with peers who are not antisocial are less likely to report gang membership. And the international literature that talks about that talks about the issues that relate to that: frequent alcohol and drug use, and negatively associated with parental monitoring and coping skills. And how do we compare? And I use a lot of data from surveys we've done among UWI students to illustrate that even among this population, which is perhaps well, obviously the prospective leaders, but also the brightest people in the society, that there are serious problems. And this study done by some students of ours 5 years ago looked at the consumption of alcohol, and you see the high levels of prevalence, both of general prevalence and of binge drinking and of comorbid marijuana use. So again, suggesting that the high levels of alcohol use are indicative of that underlying problem. And in Washington, the cost of substance abuse is estimated as, according to this study, and this is for 2005, as $5.2 billion, which is a considerable amount of money. And this is 5.2 billion, of course, US dollars. So the impact on morbidity, mortality, crime, healthcare are all profound. And again, those are things that we see around us in the society. Going back to physical health now, alcohol use and depression also predispose you to cardiovascular problems. And alcohol abuse also predisposes you to developing diabetes. So where you have a lot of depression and a lot of alcohol use, you're going to get a lot of cardiovascular problems and a lot of diabetes. Again, those things are extremely prevalent in Trinidad particularly, but also Tobago. And in Tobago, some researchers from the London School of Hygiene and Tropical Medicine did a study on people, men in Tobago who died before 60 years of age. And the strongest epidemiological factor associated with those deaths was high sessional alcohol intake. And again, high sessional alcohol intake is especially common here, so-called binge drinking. And many people don't see that as a problem because they think, well, they don't drink for most days of the week. But when they do drink on a Friday or a Saturday, they drink quite heavily. And this has serious cardiovascular implications, as noted in this slide, where it was 27% for all-cause mortality and 40% for cardiovascular disease mortality. And what about the cost of depression? Again, in the States, and again, figures from a fairly long time ago, is estimated that depression costs the United States economy $83 billion. Most of it, as you see, from lost productivity, absenteeism, and presenteeism, as well as the direct costs related to care, and of course, the costs related to suicide. Presenteeism is also interesting because it's something, again, that we don't often consider, and of course that refers to when people show up to work but don't actually perform, or certainly don't perform to their full potential. And that in itself is thought to cost about $200 billion a year. Study in the Harvard Business Review suggested this. And that $200 billion is due mainly to depression, undiagnosed, and of course untreated depression and paid conditions. And they summarized it by saying when people don't feel good, they don't do their best work. So again, purely in terms of productivity, you see how the presence of these conditions affect the economy. And in Trinidad, again, going back to the illness thing, Rohan Maharaj, looking at diabetes in health centers, found that the prevalence of depression was approximately 27%. And that presence was associated with poorer sugar control and also with poor compliance and adherence. And he hypothesized that the problems with sugar control or glycemic control were related to the under-recognition of depression. And a study in Barbados, Mike Campbell, they found that depression in their population was associated with burnout and absenteeism, decreased maternal care, obesity, and chronic disease. So again, you see depression strongly associated with physical illness and all the problems we talked about, but also things like HIV, renal disease, cancer, and a range of other conditions. In Trinidad, again, it's not commonly, perhaps more commonly known now, we have a fairly high rate of suicide, the highest rate in the English-speaking Caribbean, apart from Guyana, and that leap took place around 1990 and has remained fairly stable since, up until today. And again, that too is a function of a lot of underdiagnosed or undiagnosed depression and treatment. And again, looking at UV students, we found that 30% of them had a history of self-harm behavior, 22% more than once but less than 10 times, and about a quarter of them a history of childhood sexual abuse. So the problems in society relate to the problems in mental health. A study from CARFA showed that crime and violence, injuries and accidents, violence to self, the leading cause of death in the under 44 years age group. And we have another major problem in terms of aging and the mental health impact of that. And this study points out that by 2050, 1/4 of our population will be over 60, with the consequent implications for health. In some countries, and Trinidad is one of them, it's thought that it's going to take place by 2030. The current level is 12%. So again, that's a burgeoning epidemic. So this is the last slide. I think the mechanisms by which this occurs and what we have to deal with: maternal depression, childhood sexual abuse, intimate partner violence, all lead to decreased parental effectiveness, which in turn lead to cognitive deficits and psychopathology, which in turn lead to things like self-harm, crime and violence, and then to adult psychopathology, depression, personality disorder, crime, violence, presenteeism. They in turn are associated with poorer physical health and decreased productivity, decreased capability efficiency, and in turn also cause the high levels of mistrust, poorly functioning institutions, a dysfunctional society, and perhaps most importantly, a cognitively dull society. Thank you.